So what I wanted to talk about is the idea of this statewide efforts that are pushing universal health care. In a sense, like I have this theory that you throw everything against the wall and see what sticks. So I obviously support the movement for national Medicare for all, but there are a couple of states that are closer than others in getting it. And I thought it was interesting that in the history, the two states that were historically doing it are the two states that are doing it now, like primarily of New York and California.
And Vermont. Vermont was the first, actually.
Vermont was the first.
Yeah.
Okay. So what happened to those plans? Like, this is not the first, people think this is like the first time this is all coming up, and it isn't. People have been trying to do this for a long time.
Yeah. First, just a super quick background. This is how Canada got single payer health insurance. Yeah. Saskatchewan did it first, Tommy Douglas, the premier. And it was back in the early 60s, and it was so successful that all the other provinces wanted it. And within a decade, it had spread across the nation. And then the federal government jumped in and put together a payment system. So if somebody from Saskatchewan gets sick in Ontario, they can route the money between the provinces. So about a decade ago in Vermont, Peter Shumlin, who was the head of the Vermont Senate, he was a senator, ran for governor, and he ran on the platform of Medicare for all, single payer healthcare in Vermont. He was elected. The Democrats took the House and Senate. They passed it. He signed it, put it into law. Hired a friend of mine actually as his head of whatever they call it in Vermont, the Health and Welfare Administration, to put it into place. And what they discovered was that back in '65, when Lyndon Johnson put together Medicare, he wanted to make sure that Medicare money didn't go to the southern states and they take the money but refuse to give services to Black people. So there's kind of an audit trail from the federal dollars being written or being sent down to the state to the ultimate consumer of healthcare. And if you insert a single payer system, a state-based single payer system into that, it breaks that chain. And so what came out of this, even though Medicare for all is the law of the land right now in Vermont, or single payer healthcare is the law of the land in Vermont, it has been for years, was they couldn't put it into place because all of the Medicare money and all of the Medicaid money coming into the state, which is billions and billions of dollars, would go to zero. It would just vanish. And the state would have to start paying for everybody over 65 and all the working poor. And that would have just bankrupted Vermont. So the magic words when you call your state your U.S. representative, member of the House of Representatives, and your two senators at 202-224-3121, the magic words are Congress needs to pass a state waiver so that Medicare and Medicaid waiver so that individual states can put into place single payer healthcare systems. The actual legal mumbo jumbo has to do with ERISA and all these acronyms and stuff. But if you just say it like that, they understand exactly what you're talking about. Democrats have been trying to get this through Congress for 2 decades now. And of course, the insurance companies and the Republicans fight it tooth and nail. But that's what we need to do.
I mean, look, we could also say there's a fair share of Democrats that are not playing ball with us also. I mean, not all Democrats are the same. Not all Democrats are created equal, Tom.
Oh yeah, just down the road, I'm here in Portland, and just a little bit south of Portland, the district that is represented by Kurt Schrader, and he's the guy. He was one of the Democrats who yesterday voted to kill the ability of Medicare to negotiate drug prices. He was the deciding vote that killed it.
Yeah, it's very frustrating, and I even look at the numbers that we see. There's, I forget, 100 and something Congress members that are in the quote unquote progressive caucus. And yet none of them or so many of them are not really loud on this. They might say, okay, yeah, if it gets put there, then I'll sign it, kind of, whatever. But if all of the people that were on that bill were really out pushing it and really fighting for it and trying to bring in other people into Congress that also supported the idea of having a nonprofit healthcare system, I think it would be a lot more effective than just sitting there waiting for it to happen.
I agree.
And that's a lot of the Democrats too right now.
Yeah, I would add, though, that the lesson of the 60s of how Lyndon Johnson got the Civil Rights Act, the Voting Rights Act, Medicare, Medicaid, all that stuff passed is it takes leadership. And that's why I was really pleased to see that yesterday Joe Biden met privately with Kyrsten Sinema and Joe Manchin. We still, we don't know what came out of that, but things are moving forward.
I hope so. Somebody needs to put those two in their place. Like, it's like they're just not, or at some point, don't you think you would look at certain people and you're just not a Democrat. You're just not a Democrat. Accept that. Like, Joe Manchin is not a Democrat. Just accept that and move on.
Well, Joe goes along with the Democratic Party on the things that don't really influence his taxes or his coal business. We just learned, The Intercept just did some amazing reporting that he has started 3 different coal companies. His son owns one of them. He's divested himself, or he's got them in a blind trust. He made $500,000 last year off coal. And his daughter is the head of, or was the head of Mylan Pharmaceuticals, the company that tripled the price of EpiPens. And so it's like, it's kind of all in the family, right? But in some ways, at least we've got 50 Democrats in the Senate. I mean, the fear is if you lean on Joe Biden or Kyrsten Sinema too, and Kyrsten Sinema, I think, is kind of I think she's just she thinks she's John McCain. She's trying to become famous, as the mavericky person, because she's from Arizona. And Arizonans are just not buying it. So instead, she's now sucking up to the billionaire class, the right-wing billionaire class, and the Mitch McConnell. But if they leave the Democratic Party, like Jim Jeffords of Vermont left the Republican Party in the early 2000s and flipped the Senate to the Democrats, it would be a disaster. So, we want to lean on them, we want to push them, but we don't want to beat them up too bad.
Thanks for watching. If you want to support our mission to transform politics into service, please like this video, subscribe, follow us on social media, and consider joining our Patreon, where you'll get early access to our interviews as well as other exclusive content. Links are in the description. Peace out.